Mistakes in the operating room.
There was a surgical sponge left in my abdominal cavity.
Patients' lives destroyed by preventable medical errors. 9 investigates, exposing secret settlements that protect hospitals and keep you in the dark. Next.
Mistakes in hospitals happen more often than you know, and healthcare systems pay millions of dollars to keep it that way.
They're called secret settlements or confidentiality agreements, and they prohibit those involved from speaking about wrongdoing. Eyewitness News anchor Sarah Rosario met a woman who says hospital negligence ruined her life.
There was so much anger. So much hurt.
Debbie Pennington is finally speaking out 20 years after a surgical sponge was left in her body during a partial hysterectomy at a hospital in Elkin, North Carolina.
It was folded up to the size of a pack of cigarettes.
Bound by a confidentiality agreement, Pennington can't discuss the settlement she accepted, but she says she endured years of pain and 5 additional surgeries to fix the mistake.
I've never come back to 100%.
Pennington is now calling for changes to laws allowing confidentiality agreements. Laws, she says, protect hospitals and keep the public from ever knowing about life-threatening mistakes.
It's not fair to the public.
As long as doctors have special protections under the law, there's no incentive for them to take the steps necessary to really get a grip on this problem and fix it.
Charlotte lawyer Charles Manette says an overhaul of state medical malpractice laws in 2011 gave healthcare providers even more protection. It not only capped payouts for pain and suffering at $500,000, but Manette says it makes it harder for patients to sue and for lawyers to fight cases unless there's a death or near-death experience.
There's never going to be an effective patient lobby that can stand up against the lobby of the entire healthcare industry.
Charlotte attorney Tricia Durr represents healthcare providers. She admits mistakes are made, but says their top priority is saving lives, which she says can be more complicated than it may seem.
They're trying to save this person's life. Sponge counts become less important than, say, for example, stopping bleeding.
Durr says secret settlements have a place in the legal system. She says sometimes it's the patient who requests them, not the hospitals covering up a mistake.
In 18 years of doing this, I've never seen a situation where there's been a cover-up. I'm not saying that that doesn't happen, but I'm not aware of it.
Durham lawyer and Senator Floyd McKissick Jr. says when a preventable mistake poses a public health or safety risk, people need to know. A new bill he's working on would leave it up to a judge to decide.
Transparency is absolutely essential. It is critical. And we need a judge to make a determination if something will be kept secret, private, or confidential, that there's not going to be that great of a risk of danger to others.
Pennington says it's time patients get access to what could be life-saving information and time for hospitals to be held accountable for paying patients like her to stay quiet.
It shouldn't have to be hidden because you're walking proof that it did happen.
Sarah Rosario, Channel 9 Eyewitness News.
We checked safety scores of hospital systems in our area. CMC Maine received a C rating. Novant Health Presbyterian received a B rating. And both Piedmont Medical Center and Caromont Medical Center received A ratings. For more about hospital ratings, go to WSOCTV.com. Look for Sarah's story under the 9 Investigates tab.